Do you suffer from knee pain and have seen an orthopedic surgeon only to be told that your knee is worn out and needs a knee replacement? If so, you've been given outdated information. Your knee pain may not be at all due to wear and tear arthritis or osteoarthritis. The idea that knee osteoarthritis is purely a wear and tear condition is outdated and oversimplified. While mechanical stress and joint loading do play roles, modern research shows that osteoarthritis is a complex, multifactorial disease involving more than just cartilage erosion from use. Why wear and tear is inadequate? The wear and tear model implies that using the joint inevitably causes it to degenerate like a mechanical part. But regular joint use, like walking, doesn't necessarily cause OA. And in fact, exercise is protective. Some people with heavy joint use, example athletes, laborers, never develop OA, osteoarthritis, while others with sedentary lifestyles do this. This points to other factors, modern understanding, multifactorial pathogenesis, low-grade inflammation. OA is now being recognized as involving chronic low-grade inflammation of the joint. Synovitis or inflammation of the synovial membrane is commonly seen even in early stages. Inflammatory mediators, example cytokines like IL-1, TNF-alpha, promote cartilage degradation. Metabolic factors. Obesity increases OA risk not only via mechanical load but also through systemic inflammation from adipokines, fat-derived hormones. Even non-weight-bearing joints like hands are more affected in obese people, supporting the metabolic theory. Genetic predisposition. Genetic variants affect collagen formation, bone structure, and cartilage repair. OA tends to run in families. Biomechanics and joint alignment. Malalignment, example varus, bonies, valgus, knock knees, and joint instability accelerate cartilage loss. Previous injuries like ACL tears significantly increase OA risk. Cartilage biology and repair failure. Cartilage has limited regenerative capacity. Age-related changes in cartilage matrix, reduced chondrocyte activity, and cellular senescence all contribute. Subchondral bone and bone marrow edema. Changes in the underlying bone beneath the cartilage, thickening or sclerosis, cysts, lesions precede or accompany cartilage changes. Bone remodeling plays an active role in OA. In summary, osteoarthritis is not just wear and tear. It's a whole joint disease involving cartilage, bone, synovium, and surrounding tissues, with contributions from mechanical stress, inflammation, metabolic dysfunction, aging, and genetics. What are the implications? Treatments should not only focus on pain relief and load reduction, but also on modulating inflammation, improving joint alignment, managing obesity, and possibly targeting molecular pathways in the future. I provide orthobiologic treatment and knee replacement for knee OA. If you want to know more about them, then see this website www.orthobiologicsurgeryindia.com. If you're interested, then like and share this video, subscribe to receive information notifications about new updates. I'll see you in another video. Thank you.